Chris Godinez, licensed professional counselor, also the host of We Need to Talk on every Sunday at noon. And then I post this video up to Facebook. This video is for educational and informational purposes only. The views and opinions stated herein are mine and mine alone. They do not represent the ACA, the APA, or any other therapist for that matter. Boom, shakalaka, done. I would like to thank my sponsor, BetterHelp, BetterHelp, BetterHelp.com/Chris Godinez. They're an online therapy company. They are international. So if you are anywhere in the world and you need to get to a master's level or PhD level, then go to BetterHelp.com/Chris Godinez, fill out a questionnaire, and they will place you with somebody here in the US of A. Also, if you don't like them, you can always go back and say, hey, we didn't mesh, and they'll have you answer some questions, fill out some more questions, and then they'll set you up with somebody else. So thank you, BetterHelp.com/Chris Godinez. Also, apparently they also do chatting. So you can do chatting instead of video. You can also do video, which is, I think, pretty darn cool because the chatting would be good in case you can't talk out loud. You know what I'm saying? So anyway, BetterHelp.com/Chris Godinez. Okay. All right. Hi, guys. Oh my gosh. Hello, Spain. How are you? So today's current event, Merriam-Webster declared gaslighting the word of the year. And I'm thrilled because this means that the education is getting out. People are getting out. Oh, one other thing. I forgot to mention Susanna Quintana. Susanna Quintana, SusannaQuintana.com. She's amazing. Her book is amazing. She's awesome. You're still that girl. You want to do that. Okay. Now getting back to the current event. Gaslighting is the word of the year by Merriam-Webster. So it means the education is working, which is phenomenal, but I don't want the true meaning of the word gaslighting to be lost. Gaslighting should be a blaring red flag. That should be like a siren going off, like tornado is incoming, that kind of thing. It's been kind of, to simply explain it, people say, oh, it's lying. Well, it's more than lying. Gaslighting is intentionally lying and changing the history, rewriting the history in order to confuse the target of abuse, in order to make the target of abuse question their reality. That's what gaslighting is. It's based on the play and the movie where the bad guy would, use the gaslight up in the attic to try to find the treasure. He married this woman. He was going to steal her family fortune from her. And so the gaslights in the lower parts of the house would keep changing. And he kept saying, oh no, nothing's changing. You're not seeing that. That's not happening. You're crazy. Sound familiar? So the real meaning of gaslighting is not just lying. It's lying with the absolute intent of warping the target's perception of reality. So I'm thrilled on one hand that it's finally out there. It is now the word of the year, which means, Merriam-Webster, that means that it's being used a lot. People are recognizing it. And though we've got to understand that if somebody is gaslighting, they are trying to intentionally change the perception of the person they are lying to. So it's more than just lying. It's with the intent of causing the person absolute confusion. It's with the intent of causing the person to question their own reality, question their own perception. So keep the education up, guys. Keep sharing the videos. Keep sharing the podcasts. Yes, this is available on podcast. You can go to anywhere where you get your podcasts, Apple, Android, etc. It's available on all of those platforms. Keep sharing, and keep talking about it because it's working. It's working. People are learning, and that's what we need. So we need to have all of the words involved with domestic violence be known, right? So that it's no longer this hidden thing that we don't talk about, we don't mention, we don't whatever. So I'm thrilled that Merriam-Webster made gaslighting the word of the year. I just don't want the actual deep meaning of it to be lost. It's more than just lying. It is lying with the intent of changing the target of abuse's perception of reality. That's what gaslighting is. So continue to educate, guys. Continue to share, continue to educate, and call it out when you see it. Call it out. If you see it in public spots, call it out. If you see it in politicians, call it out. If you see it in your everyday stuff, call it out. No more of this stuff. The problem of it is that the abusive behavior has become normalized, and that's not okay. We never want to normalize abusive behavior. That cannot be the norm. because once that becomes the norm, then it's like free for all. You know what I'm saying? So when we are able to call it out and make it unacceptable to treat people the way narcissists treat people or the way that abusers treat people, that's a very good thing. So this to me is a step in the absolute right direction. So yay, Merriam-Webster. So yeah, so keep educating, keep sharing, keep doing whatever it is you guys are doing because it's working. It's working and I'm thrilled. So anyway, there it is. Okay. All right. So medical trauma. So I've gotten this one a couple of times from listeners that have said, can you do something on medical trauma? All right. So medical trauma is created when we are in a situation under the care, the loving care sometimes of narcissists who are doctors, and we have a life-threatening event and it's a medical procedure and we get PTSD from it. So remember, trauma, PTSD comes from trauma, and it doesn't matter what the trauma is. It can be anything. It can be a medical event. It could be an accident. It could be witnessing an accident. It could be from having somebody be in the hospital. You can also be traumatized by that. So trauma, medical trauma, is more likely to occur if the person has had verbal, physical, mental abuse prior to the medical trauma, okay? And or if the person experiencing the medical trauma was very little when they went into the hospital or whatever. So in cases, say, for example, the child has something that forces them to be separated from their parents, their caregivers, and they're in the hospital. That's traumatic to a kid. And it drives me crazy when I hear doctors, nurses, not so much a lot these days, but when I was a younger person, they would say, oh, they're too young, they don't remember. Kids can remember, guys. And if they can't remember cognitively, they are going to remember body-wise. Remember, the body keeps score. We remember things physically. So medical trauma is going through a medical procedure or having a very traumatic event happen that involves doctors, nurses, et cetera, et cetera, et cetera. And it's PTSD. And so just like, okay, so for example, how many people hate going to the dentist? Okay, if you talk to them, if you talk to people that hate going to the dentist, the number one reason why is because they've had a very, very bad traumatic experience with a dentist. So it was either painful or the dentist was rough with them or, something like that. That's all trauma. You're not crazy. That's all trauma, So, okay, I wanted to talk specifically about, and let's hope I can get over here and make it big so I can see it. Okay, hold on. Okay, medical trauma affects treatments and how to cope. This is on choosingtherapy.com. Oh, yay, I can make it bigger. That's awesome. Okay, medical trauma is a form of psychological trauma resulting from medical diagnosis or intervention. The resulting symptoms can include post-traumatic stress disorder, depression, anxiety, and disrupted sleep. Through acknowledgement and acceptance, and with the proper treatment from a mental health care professional, one that's not a narcissist, thank you very much, most people can manage their symptoms and experience a full recovery from this kind of trauma. So basically, the big thing is you acknowledge it. You acknowledge it. It's like, oh, hell yeah, I don't like going to the doctor, or I don't like hospitals, or I don't like whatever. And think about it. What would cause that kind of trauma? Well, if you're a little one, and even if you're not a little one and you're just a normal, adult, you have no control. Power has been taken away from you. If you're having to have an emergency surgery, you got no say in this, And so your life is literally in the hands of total strangers. That's stressful, just a titch. You know what I'm saying? So it makes perfect sense. Couple that with the fact that there are a lot of medical professionals out there that have no business being in my profession or in the medical profession. So because they're narcissists, they're abusers, and we're going to get to how to deal with those kind of jackwagons. Hang on just a second. I want to get back to this article. Okay. Recovery from trauma of any kind can be a challenge, but you don't have to do it alone. So again, you can call betterhelp.com/Chris Godinez Find a good trauma therapist, find somebody who is trauma informed. And I want to be clear, I've had a couple of clients, potential clients, that think that trauma therapy is immediate, that it's going to fix everything this second. It's not. It's not. Trauma is going to be a lifelong thing. It's always going to be there. It's not just going to magically disappear. It will lessen. It will not be as intense. You'll have better coping skills, that kind of thing. But it's not like you're going to go to therapy once or do an EMDR session once and magic pill, boom, everything's done. And a lot of people, especially younger people, think somehow that EMDR or CBT or whatever, I do CBT, that somehow they're going to go to one session and it's going to fix all their problems. That is not the way the world works. Trust me, if it did, I'd be retired and I'd be running a bed and breakfast somewhere on a beach. So you want to give yourself time, and you also want to talk to your therapist and let them know what your expectations are so that they can bring you to reality, or they can say, hey, here's how it's going to go. What are you hoping to get out of this? That's always what I tell people. It's like, if you're looking for a therapist, make sure that the therapist is asking you, what do you hope to get out of therapy? What are you looking for, so that I can help you get to that goal? So, okay. So medical trauma, no different than any other trauma in that it's still PTSD, anxiety, depression. Okay. Yes, you can develop PTSD from medical trauma. They occur between 5 to 63% of ICU survivors. In one report, about 1 to 5 patients in the ICU have some level of PTSD. Again, it's out of your control. You've got all of these people that are total strangers poking and prodding you and putting things down your throat and oxygen and everything else. So yeah, it's going to cause PTSD. And especially if there's been abuse in your childhood and you're, again, being poked and prodded and things like that, it's going to exacerbate the PTSD that's already there. So studies show that the risk factors of PTSD in patients in the ICU include pre-ICU anxiety or depressive disorders, sedation and physical restraint. Yeah, because you're, again, out of control. Recall of an ICU nightmares and psychotic experiences. The risk factors are applicable to other hospital settings as well. Signs of PTSD after medical trauma: persistent, intrusive thoughts or memories of aspects of the medical event, replaying the memory of getting the diagnosis, or replaying the memory of the surgery, or replaying the memory of whatever event caused the PTSD. Significant distress when confronted with reminders of the medical trauma, including medical appointments. Absolutely. Disruptions in treatment adherence due to trauma-related avoidance, overutilization of healthcare related to hypervigilance. So the lasting mental health effects of medical trauma. Trauma experienced as a result of medical procedures, illness, and hospital stays can have lasting effects, like developing anxiety and depression. When the medical condition, I forgot to turn my sound off. Darn, there we go. When the medical condition has been successfully treated, that doesn't necessarily mean that the mental health issues related to the trauma will also end. So there's so many layers to this. Okay. Successful treatment, great. But if you're a child in a hospital setting and you had like something that was life-threatening, or you had something where you had to be immobilized, or you had something and it was successfully treated, that's great. But if you had trauma about that particular event, that's still going to carry through, because remember, cognitively, kids don't know how to cope with that kind of fear and that kind of stress, especially if they're little ones, And I've had cases where the client has had to go into the hospital as a little one, and either the parents just didn't visit, or the staff told them not to visit, which I can't imagine a good doctor doing that. But, and that causes trauma for a child. It causes abandonment. It feels like they're being abandoned by their closest family. And they don't know how to cope with that kind of fear. They don't understand what's going on. They don't get it, and if they've also got healthcare staff that is on the spectrum here, and I don't mean the autism spectrum, I mean the narcissist spectrum, that doesn't make it very easy for them. So, because you've got nurses or doctors that are being mean, bullying, and not helping if the child is crying or if the child is upset or whatever. And so that's like double, yay, double the trauma. So, not only do you have the medical stuff going on, but you're being abused by a narcissistic nurse or a narcissistic doctor or whatever. And that's just not okay. Not okay. We're going to get to how to deal with those people in just a moment. Hold on. Let me get back to this article. Okay. Those who experience medical trauma may also develop PTSD, anxiety, depression, complicated grief, and somatic complaints. So, in other words, very concerned about the body, very concerned about what's going on, and that's common. Symptoms and responses to medical trauma are comparable with other types of physical trauma, like being in an automobile crash or experiencing physical abuse. The Anxiety and Depression Association of America, ADAA, says that the difference between PTSD and the experience of trauma that is a traumatic event is time-based, while PTSD is a longer-term condition where one continues to re-experience the events and have flashbacks. So, yeah, absolutely. You can have flashbacks having had medical trauma. Now, something else that clients have reported to me, now we're validating the medical trauma. Now we're going to slide into dealing with the providers that are jerks. Something else that clients have reported to me was being abused physically while they were under the care of a nurse, a physician, etc. So, what can you do? And here's the thing I want to make very clear. Remember, abusers, no matter who they are, they go after the people that they think they can intimidate and that they think they can abuse. And remember, we have no more meaning to them than this pencil. We are objects to them. So if you are dealing with let me find that article. Hang on just a second. Let me get rid of this one. How to deal with an arrogant doctor. I love that. Okay. So the thing of it is talking to them is not going to do any good. So I saw some articles that obviously did not get it that were like, oh, just talk to them. No, absolutely not. How much success have we ever had trying to talk logic to a narcissist? Anybody? Bueller? Seriously, you would have a deeper conversation with my backdrop. Seriously. So if you are dealing with an arrogant doctor, that is a red flag. Now, does that mean automatically that they're necessarily bad? Maybe, maybe not. But if they're not willing to work with you, if they're not willing to communicate, if they're not willing to be a human freaking being and assure you and calm you down and help you with your fears, then this is probably not the right doctor for you, especially if you are dealing with a life-threatening situation, like, say, for example, cancer or some other, long-term or terminal disease or possibly terminal disease. Do you see where I'm going with that? You want somebody who can be like, hey, here's the treatment plan. Here's what we're going to do. Ask as many questions as you need to. Arrogant doctors don't like to be questioned. You ever notice that? If you ask them a question, even if it's like a reasonable one, they're condescending as all get out. They look down at you like you're an amoeba. And why are you bothering me with this? Well, for one thing, I'm paying your kids' college tuition, you jack. So you know what I'm saying. So yeah, I personally, I would not stick with a doctor that was arrogant or narcissistic. Why? Well, because they don't ever want to be wrong. You need a doctor who's willing to go, this isn't working. Maybe I was wrong. Let's get a second opinion, right? Or let's try this other treatment or whatever. There have been these narcissistic doctors out there that for their ego's sake will not refer out to a second opinion, get butthurt if you get a second opinion. You should always be able to go get a second opinion. Second opinions are good. It means you have more eyes on it, right? More eyes, the better, right? So, okay, let's get back to this article. Okay, let's make it bigger so I can see it. Okay. First of all, understand that this arrogant doctor would deny he's egotistical and would deny he was arrogant. He would also deny that he's being a bully or has an inferiority complex. And yes, narcissists have an inferiority complex. That's why they're doing this. I'm great. I'm great. I'm great. Look how great I am. That kind of thing. In truth, he has developed that personality because it serves his purpose. People are so intimidated that they don't even try to get to know him or ask questions, or her. They can be female too. He doesn't want to be pleasant or kind because then people would discover just how inferior he or she is. Okay. He doesn't want to be friendly because they don't have emotions. Hello. Recognize that this difficult personality, he may or may not be a good healthcare provider. I wouldn't stay with them. I honestly wouldn't. You need to work to discover whether this person can truly help you or not. Now, if this person really knows what they're doing, that's great. And you just got to know, okay, they're arrogant. This is what they do. Personally, I wouldn't. I wouldn't. I wouldn't trust them. I don't trust them to have their patient's best interest at heart. Now, the only reason that they would is because they don't want to be known as a doctor that kills their patients. So, I mean, there is that, but it's kind of like lawyers who want to have the most wins in court. They don't want to lose because it makes them look bad. So, all right. Ironically, their inferiority complex may work in your favor. If you have difficult illness or puzzling symptoms, he may want to prove his or her superiority and view you as a success as a healthcare provider. So that's a possibility. I think that's a very slight possibility. I don't trust that. Communication is critical. So be sure that the doctor's ego is not inhibiting your ability to communicate. So like I said, a lot of these arrogant doctors and nurses, male and female, it's not just male or female, they inhibit the patient's ability to ask questions by getting that nasty, I'm better than you, you're an amoeba, why are you asking me this question? Honest to God, guys, it's like, look, ask as many questions as you need to. And a good therapist, a good doctor, a good nurse, a good whatever will be patient and will listen to your concerns and encourage you to ask questions. An informed client, an informed patient is a great client, a great patient, because now they've got the information and they can help self-soothe themselves. Does that make sense? Knowledge is power. So, because when you're going into a medical situation, it's like going into a courtroom. Seriously. Remember how I said the courtroom is like a whole new world and it's got its own set of language and things like that. And if you have not gone through medical school, you're not going to understand a lot of the jargon or a lot of the shortcuts or a lot of what they're talking about. So ask them to explain it to you so that you understand it. It's your right. It's your body. It's your right. You have the right to know what this procedure is. What do you mean you're going to go in through my belly button? What does this mean? What is laparoscopic surgery? What is that? You get to ask those questions. You get to ask, well, what is the side effect of the anesthesia? And, what can I expect? And, that kind of thing. So, I mean, the best doctors are the ones that talk you through it because it is scary. It is, and especially, like I said, if you have a series of events where you've been abused in the past, maybe not medically, but then you come into a situation where this person who's supposed to be healing you is bullying you. That's no bueno. And it's scary to me too, because people who have been previously abused, we get intimidated, or we do get intimidated until we get solid ground on our self-esteem. Because as soon as somebody starts talking, down at us, what do? We tend to, clam up. And that inner child pops up and we're just like, oh no, I better not say anything. Oh, I want to people please. You're not there to please that doctor. You're not. It's not your job. That doctor better be doing their damn job and making sure you're okay. Seriously. So, okay, hold on. Let's continue. How are we doing on time? Okay, we're good. All right. All right. If the healthcare provider is arrogant and narcissistic, they will think everything they tell you is the best answer. When it comes to answering smart questions or sharing information you've learned about your condition, know that Dr. Arrogant may I love that, Dr. Arrogant, may resist the discussion, ignore you, or get angry. I swear to you, if they do that, that is a red flag. Get rid of them. Find another doctor. If you run into problems with your treatment, for example, the drug that's prescribed does not work well, then make sure you state the problem as objectively as possible. An arrogant doctor may try to make it sound as if the fault lies with you, the patient. And that's what they do. I've had so many clients tell me that that happens with psychiatrists. It's like somehow the patient's fault if the drug is not working. And I'm like, no, it means you need to find a different drug. Don't get me started. Recent studies, and this is why I would not stick with one of those doctors. Recent studies have shown a correlation between arrogance, obnoxiousness, and medical errors. Yeah, I would definitely not stick with one of those doctors. I would find a different doctor, somebody who's got an actual soul. That would be good. Okay, so that is the concern of dealing with medical professionals, and I use the term professionals loosely when I talk about narcissists, that are allowing their ego to run the show. They're dangerous. They're dangerous. I'm sorry. I know correlation does not mean causation, but I think that needs more study. I do. I really, because I don't trust them. I don't trust them. I don't trust them. They don't have your best interest at heart. In general, why would they have your best interest at heart medically if they're all ego? Does that make sense? And it is possible to find good doctors. It really is. Okay, so then I wanted to go to, is this the one I was looking at? Oh, yes. Okay, that's one. Okay, so hold on. Okay, signs your healthcare provider is a bully. Refuses to answer your questions or provide you with information about your condition. Okay, we've talked about that. Uses intimidation and manipulates you into having exams or procedures that you do not want without an explanation as to why they're medically necessary. Never allow them to do that to you. Displays arrogant and self-righteous behavior. For example, you're about to ask their experience or expertise. And people ask me all the time, well, what's your experience? Where did you get your training? And I'm happy to tell them, because that's their right to ask that question. But with abusers, they're like, how dare you question me? How dare you question my experience? Blah, blah, blah. Lacks empathy. Clearly insulted when you ask about their experience. Does not respect your need for modesty or privacy. And there's been several dentists and recently there was one it was a plastic surgeon, I think, in Florida that was accused of sexually assaulting clients. So yeah, they view us as objects. And yes, that is a possibility. So you always want to look at what are their complaints? What have people said about this person? Is there anything hinky about this person? Speaks condescendingly towards you, handles you roughly. And that's happened to several of my clients when they had situations where, it was very delicate and the person was just, jerking them around. And it's like, that's not okay. This is a person, not a thing, but again, we are things to them. Okay. Oh yeah, this is a huge one. Treats the nurses and assistants poorly. That to me is just a huge red flag. So yeah, that's not cool. And again, this will contribute to medical trauma, because if this person is not treating you with respect, because that's really what it is, respect and gentleness and compassion, and willing to hear your questions or your concerns, willing to communicate. If they're not willing to do that, don't stay with them. Find another doctor. This will all contribute to medical trauma. If you have a doctor that's like condescending and nasty and rough and mean and nasty, and you're going through this scary procedure, yeah, you're going to have PTSD. The likelihood of having PTSD, if you have a good medical staff that's kind and compassionate, is much less. It's much less. You may still have it because of the procedure itself, but not to the extent that you would if you had medical people that were just treating you like an object, or being condescending or being mean or whatever. Okay, so then the next question is, how do you deal with one of these people? What do you do if you need to file a complaint about your healthcare provider? Okay, so the first one was, okay, how to lodge a complaint, and it kind of depends on what the complaint is and where you want to go. The first step is to assess whether you should complain to the healthcare provider directly. If they're a narcissist, I would say no. I would say no. You're not going to go anywhere. So you want to find out. Now let's see. Where is this article from? This is Very Well Health, and it's how to file a complaint about your healthcare provider. Okay, so where to lodge a complaint. So you want to figure out is, do you like your provider overall, but you have a few complaints? So you might be able, if they're willing to hear it, you could talk to them directly, or you could talk to the office manager or whatever. But again, if you're dealing with a narcissist, no, you're not going to do that. If you notice an error in your medical record, but your medical care has been good, you should bring it up with the healthcare provider and the office staff. They are highly likely to correct you to your satisfaction. So that's good. Some office staff, though, again, narcissistic. I've never made a mistake in my entire life. I'm always right, blah, blah. And in that case, you need to stay on them and then switch offices. Even if the doctor is good, if their staff is not, you're going to have problems. If you feel you were insulted by your healthcare provider, then you might be more comfortable talking to someone else on the team, such as your nurse, physician assistant, or other healthcare provider. Sometimes another person can look at things objectively and guide your healthcare provider to avoid repeating this problem with you and with other patients. If the situation bothered you so much that you don't want to see that healthcare provider again, be sure to tell the office staff why you will not be using that healthcare provider services again. On the other hand, if the insult or behavior was directed at you because of race, gender, sexual orientation, age, or religion, there are civil actions you can take, including contacting the Office for Civil Rights at the U.S. Department of Health and Human Services. If you suspect that there may have been illegal or unethical billing practices, including fraudulent billing, upcoding, and balance billing, then it's important to file an appeal with your health insurance company. If your appeal is denied, your healthcare provider may have a patient advocate that can help you free of charge. If you cannot find a resolution, you can contact your state insurance commissioner. Always don't put up with that stuff. If medical error resulted in personal injury, hospitalization, disability, diminished quality of life, or death, then it is important to report the matter to the hospital or practice manager. You will need to do so with an attorney if you are seeking damages or planning to litigate. If your healthcare provider was sexually inappropriate or abusive in any way, contact the state medical board and file a police report. I cannot stress that enough. I've had clients where the healthcare provider was absolutely inappropriate, was absolutely physically abusive, and because of the intimidation factor, they didn't file a police report. They didn't file a report. You've got to file a police report, and you've got to file a complaint with the state board, 110%. Otherwise, these practitioners will go on and do the same abusive behavior with somebody else. Guarantee it. They don't stop. Let me just be clear about that. Remember dark triads? They don't stop. They don't stop. If they don't get caught behaving like crazies, they'll just continue their behavior and it keeps upping. So absolutely. And plus the fact it's taking your power back. It's like, oh, hell no, I'm not going to put up with this. I'm going to file a police report and I'm going to go to the state board and I'm going to file a complaint. And then I'm going to get an attorney. I'm going to sue you for malpractice. Abso-freaking-lutely. So that is your right. Absolutely. But again, because of the intimidation factor, we kind of think that, oh no, I shouldn't say anything. Oh no, I can't do anything. Oh no, you can. Absolutely, you can. Hold on. And then I will get to the questions. How to lodge a complaint. All right. Many government and institutional authorities allow you to file a complaint directly on their websites. For others, you may need to write a letter and send it in the mail. Okay. So if you're filing a complaint with the state board for medical, you can do it online. They have a form and you can write it out. But here's the thing. Keep your concerns concise. The content should be no more than a few paragraphs written in short sentences. Be specific about your complaints. Use bulleted lists to punctuate your points. Remain objective. Tell what happened as simply as possible rather than describing how you felt. So this is where we get into trouble because we have a tendency to over describe or over whatever. You got to understand these people just want facts, figures. That's it. Just like a judge. Facts, figures. What happened, what date, what time, what was the occurrence, were there witnesses? That's what they're looking for. They're not wanting the effect it had on you. They want facts, figures, and if there were witnesses. So yeah, absolutely. Keep it short and to the point. Tell them what action you would like to have taken and be reasonable in your expectations. For example, if your healthcare provider overbilled you, then suggesting that the healthcare provider be in jail would make you seem unreasonable. If you ask for a refund, you are more likely to receive it. Leave the legalities to the authorities. Get help if you are unable to express yourself. If you're having trouble communicating what happened to you or what you want, ask a family member or a trusted friend, excuse me, to help you, or consider hiring a patient advocate experienced in these manners. Finally, don't go in assuming that your efforts will be for naught. If your complaint is appropriate and appropriately directed, the chances are really good that it will be heard. Okay. You may or may not get the satisfaction you want, but that does not mean that you shouldn't act. Hospitals, practice managers, government offices, and state medical boards investigate and record complaints, even those that are not deemed actionable. These agencies know that not all complaints are fair to healthcare providers. However, when multiple complaints are received and a pattern of behavior is established, serious action against the healthcare provider will be taken. By evidencing inappropriate, illegal, or harmful behavior, you can help protect others, like I said, from experiencing the same problem you experienced. Excuse me. Okay. So, to recap, and then we're going to dive into the questions. Medical trauma is real, and it's more likely to occur if there's been previous abuse, physical, mental, emotional, especially if you were little when the medical event happened. So the way to treat that is kind of the same way with PTSD. So you may want to get a PTSD workbook for trauma and just put it towards the medical. This was a medical thing. It wasn't an accident. It wasn't, this, that, or the other. It was a medical event. So everything you're feeling is 100% normal. The hypervigilance, the nightmares, the flashbacks, the reliving it, that comes part and parcel with PTSD, unfortunately. Get with a good trauma therapist. In this case, I would suggest EMDR. I think talk therapy is great in conjunction with EMDR, but I think it's a really good idea to get an EMDR person to help you, especially if you're having flashbacks. So that's what I would suggest for that. With the medical profession, you don't have to put up with crap from anybody, and I don't care who the hell they think they are. Because a lot of these doctors have got this God complex, a fish complex. They've got this God complex. I can no longer talk. And they think they're God, and they think they're infallible, and they're not. They're human. And I think we forget that sometimes when we go into a scary situation. We're looking for somebody to heal us, to fix us, to make us better. And so we kind of hand our power over. Well, if they're trustworthy, that's okay. But if you've got one that's a narcissist, that's dangerous. That's dangerous. You need to make sure this person is trustworthy and good at what they do and is a good listener and is willing to answer your questions and soothe you. Medical stuff is scary. It's scary because we're not doctors. We're not. We don't know the lingo. We don't know what's going on. I don't know the procedures. I mean, I know a little bit, but I don't know, so that whoever my doctor is had better be willing to explain things to me, because otherwise I will be like, you're a jerk. I'm gone. Bye. And that's what we got to be willing to do. Okay. And don't forget, if somebody has abused you, report their hind end to the board. File a police report if it's physical abuse. But file a report if they've been emotionally abusive, rough with you, et cetera, et cetera, et cetera. Because if they're doing it to you, they'll do it to anybody. So, and we've got to get these people out, damn spot, out, I say, of our profession. Seriously. So there that is. All right. Okay. Let's go to the questions. All right. Dun, dun, dun. Let me make this bigger. Okay. Is it common for a narcissistic parent to set up abuse when the child has a serious condition? It's like they are waiting for you to be at a low point so that their abuse has more impact. Absolutely. They have no empathy whatsoever. So yeah, they'll even with adult kids, like say for example, an adult child of a narcissist gets a diagnosis of cancer or gets a diagnosis of autoimmune disease or gets a diagnosis of something serious, right? And the narcissistic parent, they will pick that point in time to attack because you're at a vulnerable point. You're scared for your life, you're scared for your health, and they will pick that point in time to just full bore go after you, fangs bared, claws bared, etc. Because they're predators. Think of it this way. If they're doing that, they're a dark triad, they're predators. They're predators, and predators attack prey that they think they can kill easily. Lions don't go after the strongest of the herd. They go for the elderly and the young. Okay? So when a predator is going after an adult child, they're attacking them when they're vulnerable. And that's absolutely what they do because they're heinous. I wouldn't even use the word human beings. They're just heinous. So yeah, absolutely they do that. Okay. Hope that answered the question. How long do we stand the psychological giving us wrong medical prescriptions until we fire them? Ooh, oh, that's a good question. Okay, so I think honestly it behooves us, especially if we're doing mental health prescriptions. So let's say that you're looking for an antidepressant or an anti-anxiety or a mood stabilizer or things like that. So basically, and realize this is my limited knowledge of this topic. It's a really good idea to talk through with your physician or your psychiatrist. It's like, look, I've heard horror stories. I don't want to be going on, going off, trying another one, going on, going off, trying another one. It's like, what can we do? Now, something I do know is that you can have DNA testing done to see what medication would work with your body type. So there's several labs throughout the valley that do that kind of thing. So, and I don't know throughout the country, but I'm sure there are. So that would be something to look into so that you would lessen the possibility of having to go onto a medication, see if it works. Month goes by, doesn't work. Okay, let's wean you off of that. Let's put you onto a new one. Let's try it for a month. Okay, let's wean you off of that. The sad reality of it is that for most people that don't get the DNA testing to see what medication works best with their bodies, that's the way it's done. It's like, try one, try it for a month, see if it, does what it's supposed to. If it doesn't, you wean them off, you put them on another one, build it up for a month. Let's see if it's doing what it's supposed to. Okay, it's not. Let's wean them off, try another one. So talk to your doctor, see if they're open to the DNA testing so that you can get one that's more specific to your body type and body needs. But that is kind of the way they do it. That's why they do it that way, is that, well, especially before DNA tests, but it's kind of like a hit and miss. Let's try this and see if it works. Let's try that and see if it works. But if you're having one that's doing this for a really long time, like a year or more, you may want to question and or fire them or get a second opinion. It's a really good idea to get a second opinion and read up. Honestly, guys, I cannot stress the importance of educating yourself. And I don't mean with, WebMD. I mean, like, go to the manufacturer, see what the side effects are, see what it does, see, what works, what doesn't work, what do they, look at journals, look at studies, look at, educate yourself on the medicines you're taking. The thing that makes me so angry is that I see like Seroquel, especially, being used off-label as a sedative. I can't even talk. Sedative to help with sleep. Well, that's great, except that Seroquel.
They said they were more talking about like autoimmune, rheumatoidal type of stuff.
Oh, thank you. Apparently, I'm completely on the wrong topic. Sorry, let me finish this thought and then we'll get to that. Okay. So Seroquel used as an off-label thing, but the side effects from Seroquel is tardive dyskinesia, which is the grimacing, and that doesn't go away. So yeah, you want to know what the side effects are. Okay, so apparently this question was more about, Johnny, say it again. It was rheumatoid, autoimmune, tumors, endocrine, neurological and rheumatology. Okay. They really should not be messing around with that for very long. You may want to get a second opinion. And if you're dealing with those different topics, you're probably dealing with different doctors, I would think, because rheumatology would be something all by itself, along with the autoimmune. Tumors would probably be a different doctor. So it's having a good care team. And if the care team is not talking to each other, that's going to lengthen the time that they take to figure out what's going on. So you want to make sure that your doctors are all talking to each other. And yeah, rheumatology, tumors, neurological would definitely be a different doctor. Yeah, if they're not talking to each other and they're not giving you an answer in a relatively timely manner, yeah, you want to look at firing them and getting a team that works together so that all of the doctors are talking to each other and talking to you, and it's a collaborative effort. Does that make sense? So yeah, I hope that answered the question. Okay, let me go to the next one. Okay. When they don't care about us having important medical stuff, how do we gather strength to go to as many crazy doctors as possible until we find one that's willing to help? I mean, real stuff. Okay. When they don't care about us having important medical stuff. Okay. So again, so many parents that are narcissistic intentionally withhold medical care from their kids. Dental, eyes, physical, it just blows my mind how many adult kids of narcissists don't know how to take care of their teeth or have got horrible eyesight because they never were allowed to go see an eye doc, or have got physical issues. Hello, we end up with autoimmune issues because of the abuse. And they don't allow us to go to the doctor. Well, why? Because they don't want eyes on it, because a doctor might ask questions like, are you being abused? That kind of thing. So it's not a matter of going to horrible doctors. No. Do your research. Look them up. Look at reviews. Look at the board. What complaints do they have against them? Find one that's good. Seriously. It's like, look at the reviews. Don't just throw a dart at the board and hope that this one's going to be okay. You have the power to kind of sort through and figure out which one is good for what you need. And you have the right to. I think that's going to be part of the mirror work with this. It's like, hi, good to see you. Guess what? It's okay for you to take care of yourself medically. It's okay for you to address the autoimmune disease. It's okay for you to address the mental health issue. It's okay for you to address giving yourself permission, because they didn't give us permission. They, oh, go away, kids, you bother me, and never let us work on or deal with whatever physically, mentally, or emotionally was going on, because they didn't want anybody to find out what they were doing. So basically, it's not gathering up the strength. It's reminding yourself you have the power. You have the power, and you have the power to do your background check on these doctors, see which one is going to work the best for you, who has the best review, and you have the right to ask as many questions as you need to make sure that this person is on board with where you are and can explain to you why or why not they're willing to work with you, or why or why not they're willing to prescribe whatever medication you need or whatever. Do you see where I'm going? It's communication. It's really communication. You have the right to ask as many questions as you want to. And you have the right to do the background check and make sure that they're a good fit for you, or that they have a good review, or that they don't have a bunch of complaints against them. So it's like, take your power back. Take your power back. And that's the most important thing. No matter what you do, whether you're looking for a therapist or a doctor or a dentist or anybody, look at the reviews. Look at what people are saying. The best reviews are word of mouth. If you can find a friend that's gotten a good doctor that really listens to them, great, go with that one. Or a dentist, or, whatever. So ask as many questions as you need to. You do not need to be at the mercy of a bunch of narcissistic medical professions. It's like, look at the reviews, look at how they treat people, people talk, honestly. And so, yeah, absolutely. That's what I would suggest. Okay. And they need to be able to tell you if they can or cannot help. It drives me crazy when somebody finally goes to a doctor after, years of being afraid, and the doctor doesn't tell them why they can or cannot help. It doesn't, no communication. You want somebody who can communicate. Absolutely. Okay. Okay. How do we repeatedly explain to doctors that we don't want to give our info on our sexual stuff or lack of sex when they keep intruding without raising the voice? How to repeat it assertively? Okay, I'm not sure I understand the context. So they may be asking that because I do know that some medications like antidepressants can cause a lack of libido. So it like kills your sex drive totally, which no bueno. And that may be why they're asking. I don't know. So I'm not quite sure what the context is, but generally, if a doctor is asking about your sex life or lack thereof, they're trying to gauge how is this medication affecting you. Now, if they're being a perv and they're wanting to know about your sex life, that's something completely different. That would be abusive. But if they're asking, and you can ask them, it's like, what is this in regards to? Can you tell me why this is important for you to know? You have the right to say that. You do. So if it's in regards to a medication that you're taking, they may be trying to gauge whether this is affecting you badly. Because let's face it, when you take a medication and it affects your sex life or it affects your weight gain, because a lot of the depressants especially tend to create weight gain. And that affects you. That affects your well-being. It affects your health. It affects other things. So again, sex life is no different. You should have a healthy sex life. And if it's a medication that's impacting that, then, they need to know, if that makes sense. But like I said, if they're not explaining to you why they need to know, then yeah, I can understand why you'd be upset, because it'd be kind of like, why are you asking me this? So you may want to ask them, just, okay, why do you need to know? What is this in regards to? You have the right. And if they cop an attitude, that tells you everything you need to know. If they cop an attitude and they don't want to tell you, okay, we're done. So a doctor should be able to say, well, I'm asking because I'm concerned about this particular medication, or I want to make sure that you're healthy, or, I don't know. I don't know why they're asking, but that would be my guess if it has to do with the medication, or if they're asking about another, overall health kind of thing. So there that is. But ask them why they're asking, and you have a right to. And if they can't give you an answer, then you don't have to answer. And you don't have to answer, period. But, that's kind of what I would suggest. What?
They said they meant just intruding, pretending I'm a lesbian or stupid if I don't talk sex, unrelated to medical stuff or any medication.
Oh, it's unrelated to any medical stuff. Oh, get rid of them. Get rid of them. If they're condescending, if they're making assumptions about your sexuality, if they're inappropriate in any way, shape, or form, it has nothing to do with medical stuff, it has nothing to do with, you can find a different doctor. Absolutely. Because the thing of it is yelling at them is not going to do any good, because if they're narcissists and they're getting off on this, remember, your anger, your sadness, your tears are delicious to abusers. So if you're getting upset, they're getting off on it. So if that's the case, then just be done. Get a different provider. Get one that's communicative, that tells you things and is not condescending or making assumptions about your sexuality. It's none of their damn business. So there you go. All right. Okay. Thank you, Johnny. When we're real sick and in huge pain and they keep pushing us, how to say, please don't push my body, I'm in pain. Ambulance, emergencies, doctor's offices. Ooh, okay, so they're palpitating you. They're trying to assess where the pain is. And they keep pushing. When we're real sick and in huge pain and they keep pushing us, how to say, please don't push my body, I'm in pain. Okay. Well, I do know that they palpitate to see what's going on, so they'll palpitate the stomach or whatever area to try to figure out what's causing the problem. The best thing to do is to just say, that really hurts. Please stop. It's like, I can't take it. It's too much, that kind of thing. In emergencies, though, they're probably gonna do what they're gonna do. The sad thing of it is I have known, again, narcissists, psychopaths are in positions of power and they are attracted to EMTs. Being an EMT, being a paramedic, being doctor, nurse, physician's assistant, etc. So when you're in an emergency, though, and you're in real pain and they're palpitating you, you're just going to have to say, that really hurts, please stop. And other than that, again, that's that powerless thing, isn't it? And if you're dealing with a psychopath, they'll just keep going. So stories I could tell you would definitely shock you, or maybe not. I don't know. But there are EMTs out there that are sadists. Absolutely. There are doctors out there that are sadists, because remember, dark triads tend to be sadists. So all you can do is vocalize your concern. And if you feel the need, file a complaint, and that's really pretty much all that can be done. Okay, let's see. I think, was that it? What, baby?
They said something about they had trouble walking and they were pushing them because they were disabled. So it says.
Okay, wait, John's trying to give me more information. Hang on.
I really mean push your body when you have trouble walking because they don't like disabled people.
Oh, so they're discriminatory towards disabled people. If they're a medical profession, you report them. You absolutely, that's an ACLU thing. That is a civil liberties thing. And that's a discriminatory thing. So yeah, if they're pushing you because they're condescending towards people who have disabilities, then absolutely you file a complaint. Abso-freaking-lutely. They're not going to change. Talking to them is not going to do any good. But if you file a complaint, that'll hopefully stop that behavior, or at least there will be more eyes on it. Okay. I cannot remember what we're doing next week because my brain just totally went boop. What was the topic next week? Shoot. Well, I will talk about what the topic is on Wednesday when I answer the rest of the questions that I was not able to get to. So, okay. So there is that. I hope that helped. So you don't have to put up with condescending behavior from these people. You don't. If they're being rude to you, if they're being abusive, if they're condescending, if they're putting you down, if they're not listening to you, get a different provider. Absolutely, because you don't have to put up with that. If you are having medical trauma from a procedure, get with a good trauma therapist. Do EMDR. That's probably going to be the most helpful in combination with CBT. And be gentle with you. This is common. This is not, you're not weird. This is common, especially if there's been previous abuse in your past prior to the medical stuff. So it's more likely to happen if we've had other abuse in our past. So, excuse me. So just gentle with you. Remember to do the mirror work on self-esteem. You have the right to say no. You have the right to fire a doctor. You have the right to get a second opinion. You have the right to take your power back and read up on the medications that they may be talking about putting you on. You have the right to know the side effects. I mean, that's the thing that blows my mind. I'll talk to people and I'm like, well, did the doctor discuss with you the side effects of particularly Seroquel? No. What are the side effects? Oh my God. Tardive dyskinesia. Hello. That should be discussed. That's something you need to be watching for. So yeah, it didn't. A good doctor describes the side effects. A good doctor is open to questions, is not condescending, is willing to hear you and hear you. That's the big thing. This is the thing that all of us that went through abuse, number one thing that we've all gone through is that we were not heard. So it is super important that when you get with a medical professional, whether it is a counselor, a psychiatrist, a doctor, a nurse, whatever, they need to hear you. And if they don't, you fire them. Abso-freaking-lutely. Absolutely. All right, kids, go have a great week. I will talk to you again on Wednesday, and then I'll figure out what I'm doing because I can't remember it. And I looked it up right before I came on. Yeah. Okay. Well, I will talk to you on Wednesday. You guys be good. Have a great week, and I'll talk to you later. Bye.